can artificial intelligence diagnose diabetes, and what can we do to prevent ourselves from getting diabetes in the future? All will be revealed on this episode of Dr. Nora. Following on from my previous episodes where I've been testing out artificial intelligence in depth to see just how good it can be used to aid clinicians in their general practice, I'm now testing it to another extreme. It's time to see if it can help me with the diagnosis of diabetes or if it can give me pointers along the way. Now, keeping with my previous videos, I'll be presenting with a case and then I'm going to be adding in some examination findings and seeing if it does change its mind and if it makes it a little bit more accurate in terms of what its guidance will be. So without further ado, let's get testing. For this, I'm going to be using Diagnose Pad, which is an offline medical AI assistant application that is available on your device, meaning that none of that precious data goes into the cloud, into the service, helping to maintain that secrecy and privacy that should exist between your doctor and patient. So this app works offline. So just to show you guys, I'm not using any Wi-Fi and I've downloaded it onto my device. So let's get going. I'm going to be role playing a female and I have just had my 45th birthday. Let's go. Hello, doctor. Oh, hello, Carol. Hi, doctor. I just turned 45 3 weeks ago. And, for the past, I think 6 months or so, I've just been feeling so tired and exhausted, fatigued. And I have this constant fatigueness and brain fog. And really interestingly, I've been getting up to the toilet to pass water more frequently at nighttime. And I just feel not my usual self. Let's just pause it there. Now, that is actually a very common presentation that some people may present to me in general practice. And often I see general practice as being like a Sherlock Holmes type character. You have to dig a little bit deeper into their symptoms to see if you can get a particular line to go down and travel down to see if you can get the end result or pick up more clues along the way. Let's take a look and see what Diagnose Pad has got to offer at this stage very early on during the game. So far, it's telling me that this patient could have an overactive bladder, which is very plausible. If they are going up to the toilet many times during the nighttime or even the daytime, their bladder may not be working as it should be. They may also be suffering from anemia or iron deficiency, which is where you have blood loss, maybe related to menstrual cycles, heavy menstrual cycles, perhaps other reasons as well, maybe some GI blood loss, lots of reasons why someone can get anemic. And so these are all very plausible differential diagnoses. So what I'm going to do is something a bit untraditional, is I'm going to jump straight into the examination and I am going to present my findings as I go along and let's see how the artificial intelligence reacts to that. Naturally, of course, as a general practitioner, I would definitely go more in depth into these symptoms, but just for the interest of time and just for pure interest as well, let's see how it copes. Oh, I see, Carol. Well, let's jump straight into an examination. Let me do your blood pressure. Your blood pressure looks to be nice and normal. It's 120/70. And I'll just do an examination for your heart and your lungs. And again, that is really normal. Carol, I think I should really do a blood sugar test. This is actually a blood glucose monitoring machine, which every doctor will have in their general practice, and it helps you to find an on-the-spot blood glucose reading for the patient. So if you're suspecting that somebody has got a high sugar or a low sugar because they're not presenting particularly well, it will just give you a quick indicator as to whether or not there is an issue with their sugar levels. Now, what it entails is usually the practitioner will pop usually a disposable needle into the patient's finger, draw a little bit of blood, use a cartridge strip from inside the box, place it inside the device, like so, and then place the droplet of blood onto the device. Okay, let's get going. Oh, Carol, your blood sugar level is 13.5. That is really quite high. Let's pause right there and see how Diagnose Pad reacts to that. Now, certainly with anybody presenting to you with a sugar level of 13.5, that does indicate that they might have diabetes. And so I'm hoping that this will also come up with a differential of diabetes mellitus, usually type 2. So now the application has thought about its conversation between the patient and the doctor, it's come up with a couple of differential diagnoses, and pleasingly the first one is undiagnosed type 2 diabetes, which of course is what the diagnosis is. So it does this all in real time, so it's changing constantly as the doctor and patient conversation is evolving, which is really useful for a doctor, for example. And it also has mentioned that it could be fatigue, brain fog, maybe an underlying metabolic disorder, and that may be something like a thyroid problem, and maybe some non-specific diagnoses. It also has provided me with a bunch of recommendations that I may want to do and ask the patient, for example, any recent weight changes, any family history of diabetes, and suggest additional tests like a HbA1c to assess long-term blood sugar control. So I'm quite pleased that the artificial intelligence has managed to pick up on the high glucose reading that I had in-house for this patient. And so it's given me that idea that maybe I should be thinking along the lines of possible diabetes. And before we get looking into why the artificial intelligence thinks it's diabetes, let's just have a brief chat about what diabetes actually is. This is a condition whereby a patient is not able to normalize their blood sugar levels within their bloodstream. And this could be due to a number of factors. Generally speaking, it's because they're not able to produce enough insulin, or insulin, the hormone, is not working as well. Now, insulin is produced from our organ called the pancreas, and in some patients, for example, type 1 diabetics, they aren't able to produce enough insulin to keep up with the demands of the body. And so these patients often present really at young ages and early on in life, and they require insulin in the form of injections to control their blood sugar readings. The second type of diabetes, which is type 2 diabetes, which is what our lovely Carol has got here, is a type of diabetes that is presented later on in life, and it may have environmental and genetic factors attributed to it. And we'll go into very shortly as to what you can do to prevent yourself from getting diabetes. The third type of diabetes that we have is known as gestational diabetes, and that happens just in pregnancy. And we don't really understand why this occurs, but it does occur because of hormonal shifts during pregnancy. All right, after that short interlude, let's get back into diagnosis pad. And it says that it sounds like she has grounds to diagnose her with type 2 diabetes based on several points. For example, she has been suffering from brain fog, constant fatigue, which are really plausible symptoms of diabetes. She's got frequent urination at nighttime, which is, we call it nocturia in medicine, which means you're going up to the toilet lots of times during nighttime to pass water. Even with your best efforts of not drinking before you go to bed, etc., you still have to have this frequency of going to the bathroom. It also mentions that having a blood glucose test result of 13.5 is also an issue, and that certainly is indicative of type 2 diabetes. And so it says, in conclusion, based on these indicators, it sounds like it probably most likely is type 2 diabetes. So I have to hand it to the artificial intelligence. It's actually managed to interpret the readings and the findings from the consultation from the doctor patient. And, that can be really useful in situations where you're not too sure, or you can't remember quite what the numbers would be for diagnostic of diabetes just on a pinprick blood test. Certainly, obviously, with real life situations, yes, you would do this in your clinical practice, but you'd also send the patient over for some formal blood testing. And like it did suggest, HbA1c, which is essentially looking at the 3-month blood sugar control, the previous 3-month blood sugar control for that patient. And it'll give us an indication as to whether or not they actually truly have diabetes, or whether they may be pre-diabetic. Now, we know that Carol has presented with symptoms that are concerning for diabetes, and certainly with some preliminary tests, it looks like she does have diabetes. But what could she have done to prevent diabetes in the first place? I mentioned before that type 2 diabetes is caused usually by 2 different factors. That could be genetic factors, and it can also be environmental factors. Now, obviously, you can't change your genetics, and we do know that those people who have got a family history of type 2 diabetes tend to have a high incidence of having diabetes in the future themselves. So we can't change the genetics, but what about our environmental factors? Well, that is where you can actually change. And here are my top tips to help you to prevent diabetes in the future. Firstly, make sure that you are eating a healthy and balanced diet. It is so important to have a plate at dinner time where there's lots of different colours on your plate. For example, there's green, there's yellow, there's orange, there's all sorts of colours. And often I see patients who might be carb heavy, meaning they have loads of carbohydrates for dinner time, and their plate usually looks a bit beige in colour. Now, that won't offer too many nutrients to the body. And also the other thing is carbohydrates are very heavy on the body. If you're not using those calories that you're ingesting from your carbohydrates, then what happens is those carbohydrates, yes, they get converted into glucose in your bloodstream, and if they're not being used immediately, they get stored as fat, and then that in the future can cause you to gain weight, and it can also have a negative impact on your blood sugar levels in the long run. So making sure you've got a nice, varied, balanced diet is crucial for preventing type 2 diabetes. In keeping with that, maintaining a healthy weight is also useful as well. You might have heard about the body mass index, and that is really important for patients who want to maintain a healthy lifestyle. The body mass index is measured by dividing your weight in kilograms by your height in meters squared, and that will give you a number. And hopefully that number will be between 18.5 and 24.9, which is considered as a normal BMI. In keeping with the BMI, we also know that if you have a good waist circumference, it also helps to reduce your risk of type 2 diabetes significantly. For women, we suggest having a waist circumference of no more than 80 centimeters, and for men, a waist circumference of no more than 94 centimeters. And the way that we measure the waist circumference is by going from the lowest rib that you can feel to your hip bone, top of your hip bone, and going halfway between this point. This usually does go in line with your belly button. And if you place your tape measure around your tummy in that area, not squeezing it too tightly, just laying it nice and flat, fairly loose, not too tight, that will give you an idea of what your waist circumference will be. Not only is this important to maintain a healthy waist circumference for type 2 diabetes prevention, but it's also important for preventing other conditions such as strokes and heart attacks and other general big comorbidities. Aside from eating healthy and maintaining a good BMI and a waist circumference, is also really important to keep yourself active and physical. Current recommendations is that we do exercise for 30 minutes 5 days per week, so we're getting slightly out of breath or short of breath. Now, of course, make sure that you check this with your own individual doctor to be sure that this is the correct exercise regime for yourself. Aside from all of this, it's also super important to make sure that you're not doing all the usual things like drinking excessively, smoking, and maintaining a good blood pressure as well. And your doctor will be able to guide you as to what your own target blood pressure will be. So there you have it. That is a rundown of what diabetes is, what types there are, what symptoms it might present with, and what we can do to ourselves to help prevent type 2 diabetes. I hope you guys have found this video useful. And of course, if you have any questions or comments, please don't hesitate, drop me a line in the comment section below, and I'll see you on the next one. Take care, stay healthy.